wanted to share a little bit about my first birth experience today, because I talk a lot about, and I post a lot about it kind of just in general, about my experience and just what could be like birthing in the hospital versus out of the hospital. But I share a lot of, content and pictures and videos from my second birth, just because it was just such a beautiful experience for me, and I just have documentation to share with y'all. So because I don't have a lot of documentation from my first birth, I wanted to just come on here and talk about it, because I think it's important to also hear about hospital births, both beautiful births and births that didn't go so well or didn't go as planned, which is fine, because birth is never going to be exactly what you write in your birth plan. And so I wanted to just, again, come on here, talk about my birth experience, and then just talk about what I wish I would have known going into it that I didn't know then, but I know now. And it's a lot of all of those lessons plus what I learned for my second birth. There's just I had a very different experience. I had very different education. And so I want to just share that with y'all, because most of us are still birthing in a hospital, and that's just the reality. So as much as I talk about out of hospital births, that was what I preferred and that was what I enjoyed, it's just not reality for everybody. And so nonetheless, I want you guys to take note, share this with other women who are birthing in the hospital, because you don't know, and that was my situation. You just don't know until you're in the situation, right? You don't know until you need that information and you don't have it. And you don't know that you need it because you just weren't prepared that way. So anyways, I'll just start really briefly with from the beginning. So my first birth, or my first pregnancy, was perfect. I loved being pregnant. I had morning sickness, but it was not anything past the first trimester. I worked out every day. I ate right. Everything was great. And there was no complications from the looks of it. Didn't have any bad prenatal appointments. Everything was great. And as I was getting closer to my due date, I was like, okay, my baby is dropping. I don't know what's going on, but I feel like there's no way I'm going to make it to 40 weeks. And I think sometimes we know, we kind of have an intuition, and sometimes we think we know, but babies will come when they want to come. I was at work, and for some reason I was like, I'm just over being pregnant. And I feel like if any of y'all are close to your due date, you know what that's like. You're just like, you know what, this was nice, but I'm over it now. I'm ready to meet my baby. And that was where I was at 37 weeks and 4 days. And I was at work, and a couple of coworkers and I went out to lunch that day, and we went to a Latin restaurant, I think, and I ate some really spicy food because I was just on a mission to go into labor. Which, one thing I wish that I would have known is that I should have just, my baby came when he wanted to come regardless, but I probably shouldn't have tried to start inducing labor that early on. Even though I was full term, which was great, I probably should have just let him bake a little bit more, or just, tried to wait to interfere or try to do natural induction methods until I was 39 weeks. But anyways, the day before, I was on this mission of get my baby out. So I walked 5 miles with my husband, and, we walked a lot anyways, but we were just really on a mission. So I went to get food with my coworkers, and came back from lunch and had a meeting. And a couple hours later, I had another meeting, and I was in this office, and I was standing up to show them something on the screen, and my water broke. And mind you, there's only 10 to 15% of women whose water actually breaks before they're actually in labor. And so I ended up being one of those 10 to 15%. It is not common for your water to break before you start labor, but that was me. And so I was like, uh-oh. And I had on some floral pants, so nobody would have known that. And I was on carpet, so nobody would have known that I was actually potentially in labor. which I wasn't. My water just broke. So I was like, maybe I just peed on myself. I don't really know, because I didn't expect that was going to happen to me. And so I just kept going as if nothing happened. And then like some more water came out. And I was like, can y'all excuse me? I need to go to the restroom. I think my water might have just broken. And everybody's freaking out like, oh my God, oh my gosh, oh my gosh. Went to the bathroom, realized, yes, my water did break. I did not pee on myself. And so at that point, I called my OB. I was not in labor, by the way. So I want this to also be clear. Just because your water breaks does not mean you are in labor. Okay? It means that your water broke. And it does not mean that you have to like rush or anything, because I wasn't feeling any contractions at that point. So I was very calm. Like I was not in a rush or anything. Everybody else was in a rush to get me to the hospital, but I was not. And so we called my OB, and he had me stop by the office to make sure that my water actually had broken. And he said, yes, indeed, your water has broken, but you're at a 0. And so he still sent me to the hospital, because he didn't want me to risk an infection. However, one of the lessons this is lesson number 1, if your water breaks, and of course you have to go, you know, have that relationship with your OB, but I wish that I would have known that I could have asked to labor at home until like, you know, active labor actually started. Because I was not having any contractions. And so what ended up happening was, because I was not actually in labor, but my water had broken, they decided to induce me. I did not study anything about inductions. I did not study anything about interventions when I came to preparing for birth, because I was like, I'm going to have a natural birth and that's just what it's going to be. I've trained for this, trained my body for this. I know how to breathe. I know what I'm supposed to do when I have contractions. But I was like, there's no need for me to think about epidurals. There's no need for me to think about C-sections, because that's just not going to be my story. Lo and behold, it ended up being that. And because I was not dilated at all, again, they induced me, and I was put on Pitocin. And it started slowly, but, you know, I was fine for a while. And then it started to get more intense and more intense, more intense. And like the contractions were like really, really, really strong. And I was doing what I thought I was supposed to do. I was on a birth ball. We were walking around the hospital. I was, you know, trying different positions that I had studied or researched. And it was just so intense. And I found myself like every time a contraction would come, or I would know that it was coming or starting, I felt myself like tense up, and I'm like, oh my God, here it comes again. I can't do this anymore. And I'm just like bearing my life basically through these contractions, because that minute was so long and they were so strong, because they had maxed out my Pitocin. I had the highest level, because the more that they would increase it, I just wasn't feeling it, as it wasn't super strong for me. And so every time they would come in and check, do a cervical check, I was not dilating that quickly. And lesson number 2 is, if you are going to be induced, whether you choose to be induced or you don't choose to be induced, just realize that contractions are a lot more strong and intense when they are medically induced versus when they're natural. And it's not to say that you don't need to be induced. There is a lot of information out there talking about whether or not you actually need to be induced. And so that's something that I would highly recommend y'all read up on. But I probably should have, you know, knowing what I know now, I probably should have asked to labor at home, because you can truly be at home. Even though your water has broken, you still have a good amount of time before you would, you know, increase your risk of infection, as long as you're not getting in the bath or you're not doing anything like, you know, around water or anything that's going to actually interfere with, like, you know, the area that you're going to give birth. You're really not putting yourself in a huge risky situation. And so I should have asked to go home and labor, because I probably would have progressed faster, because I would have been in a much more relaxed environment and my body would have been able to naturally progress. So that's lesson number 2. Lesson number 3 is, know that contractions that are natural versus contractions that have been, you know, artificially started or, using synthetic oxytocin through Pitocin, they are a lot stronger. And so that was what my experience was. So now we're about 17, 18 hours into labor without any medication. And except we did do nitrous oxide, which is like a more natural pain relief intervention. And so we did do that, which was helpful, definitely helpful during that process. And I still wanted to be able to move around. So that's why we chose nitrous oxide, but it did make me a little bit nauseous. So 17, 18 hours in without, other than nitrous oxide, I was like, there's no way that I can do this anymore, because they were just so strong. And then every time they did a cervical check, I was at like a 3, then a 3.5, and then a 4, but it was just progressing really, really slowly. And the lesson that I learned from that, and if you're birthing in a hospital and you have not done any sort of full childbirth education class, what you need to know is that you will progress. Most likely you will progress much slower if you are not relaxed. If you cannot get your body to relax and you cannot get your body to be in a peaceful place, of course, labor is not going to always be peaceful for everybody, but if you cannot get your body to just relax, because again, like I was saying, every contraction that would come on, the stronger they would get, I would just like kind of tense up, which made it much more painful for me. And had I known that if I can just do some more things or have my husband do some things, massages and physical touch and other forms of oxytocin, nipple stimulation, like if I knew those things then, I would have attempted to do some of those things so that my body could have released more oxytocin and been a little bit more relaxed so that I could have progressed quicker in labor. So again, about 17, 18 hours in, I was not really progressing, and I kept being offered an epidural. Even though in my birth plan I listed that I was not interested in an epidural, they kept asking me, like, do you want to get an epidural? Are you sure? Do you want to do this? And so by that point, when I was only at like a 4, and it had been 18 hours, in my mind, I was like, there's no way I can do this for another 15 hours to get to a 10. And I just gave in, and I was like, that's fine, just do the epidural, I don't even care, like I just need to rest. And so they gave me the epidural, and I was able to take a nap. And I think I took maybe an hour or 2 nap, and they came back in and they checked me again, and I had only progressed maybe like a centimeter at that point. And so I was defeated. I was really defeated. At that point, my mind had just like taken a turn, because I was so motivated. I was so determined going in, but I did not know what to expect. I did not know how to do things in labor, to change positions, to do things, to know whether or not baby was in position, because none of those things were actually being discussed with me. They didn't talk about baby's position. They didn't talk about staying relaxed. They didn't do any of those things. They did respond. I had wonderful nurses. They did respond to what my requests were, but had I been more educated, I would have been able to make better requests. So lesson number 4 here is you have to be educated on all of the things, because if you don't know what to expect during labor, if you don't know what to expect during each phase of labor, if you don't know how to change positions, if you don't know how to ask them if baby is in one position or not, and if baby is not in optimal position, how we can do something to move baby, it could be really difficult, and you could feel very much like you're doing all of this on your own. We actually interviewed a doula before we actually went into labor, and she was amazing, but we did not see at that time, we didn't see the value of it. It felt like we were hiring, or we were paying for like just a friend to be there with us. And obviously during COVID, it's different because you have to make really tough decisions on like number of people who are going to be there. But the biggest lesson overall is that I did not have the professional support that I should have had to be able to help do things, put me in positions, suggest things for my body, and advocate, or help me to advocate for myself and advocate for me in labor, so that maybe, just maybe, my outcome would have been a little bit different. And that maybe I would have progressed in labor faster. Maybe I could have done other things that would have changed, just my overall labor experience. So that is another lesson. Like, if you don't know, even if you take a bunch of classes, if you have the means to do it, and there are a lot of affordable doulas, I would highly recommend getting one. Even if your hospital says you can only have one person, whether it's a support person or a professional, see if they have virtual options, because usually doulas, if they know what they're doing, they can coach you on FaceTime. They can coach your partner, your support person, on how to do things, what movements to do, where you should go, what you should try next. Like, they can coach you through it, because if you've never been in this position before, you don't know what to expect. And it doesn't matter how many books you read and how many blogs you read, like, your story is going to be different than all of the ones that you read. So I say all that to say, get a support person if you can, and then take childbirth education classes, as many as you can, because the more information you know, the more all of this stuff will be familiar for you, and you won't be freaking out as far as like, well, what if this happens? Or what if I'm not progressing in labor? Or what if? You'll have all of these other things that you can try and exhaust your options, and you'll be more educated, so that when you're talking to your nurses, you're talking to your doctors, they will know that you know what you're talking about, and they will treat you differently because you know what you're talking about. And so had the epidural, back to the story, had the epidural, and got my nap, came back in, and I was still not really that far along. And so at that point, I couldn't really move. I was moving from side to side, but baby's heart rate was starting to drop during contractions. And from there, because I was coming up on that like 21 hour mark, I think, I was just on a clock at that point. And obviously this was not during COVID. This was a couple of years ago, but being in labor for over 20 hours in a hospital is like, and I'm not a nurse and I don't know how nurses think. I have just seen a lot of and heard about and talked to a lot of people who have had similar birth experiences, where once you get to a certain point, and you probably, it looks like you probably have a good amount of time left, like, it's much easier for a C-section to be suggested, because it could be considered failure to progress. And that was what, on top of my son's heart rate dropping slightly during some of my contractions, that was kind of like, okay, well, this combination, well, let's just go ahead and do a C-section. And so that was what my OB suggested to me at the time. And I asked, like, is this my only option? And his response was, this is probably the best option. So now that I support mamas and I've done so much, just training and education and learning just about like birth in general, I've learned that there's always another option. Now, you have to make the decision, and I'm not saying that, my outcome in birth, my first birth, would have been any different. However, I just wonder if I knew more, and if I said, okay, well, you're saying this is my best option, but I could have responded saying, well, what are my other options? And I didn't do that. And so I don't know what else could have happened. I know now, like, if baby's heart rate is dropping or there's fetal distress, it could be because baby's not in optimal position. But, if there's nobody around to support me now that I've had an epidural, to like move my body into different positions to help baby get into his optimal position, that can completely change the whole labor experience. And yes, a C-section at that point is much easier and quicker as far as my whole birth and their, efficiency in whatever needs to happen for them. Because now my doctor has been on call for over 20 hours and he's probably tired because he can't go home. So anyways, say all that to say, ended up in an emergency C-section situation, and I was just very emotional. I was very distraught. I felt really terrible that I felt like my body had failed me, that I had failed my body, that all the things that I was doing that I thought I was supposed to do wasn't enough. And I'll share all this with you to say that ultimately my safety and my baby's safety was most important. And in that moment, because I didn't know any better, that was the decision that I felt was best because of the guidance and things that I was given from my doctor. I would not change it because I know that we were safe. However, I wish that I would have known more so that maybe I could have done some different things while I was in labor to maybe have a different outcome and to just be able to better advocate for myself, because you just don't know until you're in a situation where you feel like you or your baby could be in danger, and then you have to make what could seem like a life or death situation. Knowing what I know now, I don't necessarily believe that it was a life or death situation. I do think that there was just a little bit of impatience, and I didn't really have a ton of encouragement, right? I'm not the only person that these doctors and nurses are supporting. And and that was the difference for me between being in a birth center and being at a hospital, is that all the attention was on me. My midwives were only focused on me. My doula was only focused on me. So I had someone there supporting me 100% of the time so that there was no distractions. And they expected that labor was going to take a while. I don't think that, I think hospitals know, first-time moms, we labor for a lot longer most of the time. But I do think at a certain point, it can become all right, we're on a clock now. So I hope that these lessons, were helpful. If you are going into the hospital, really my biggest piece of advice, or no matter where you're birthing, really, my biggest piece of advice is just to have as much education as possible, because the more people I talk to and the more research that I read, there is a very big difference on how patients are treated when they're educated and when they're not. And if you are very clear that you're educated and you ask the right questions and you figure out your risks, your benefits, what alternatives there are for a particular recommendation that is given to you, and you ask the right questions, it'll be very clear that you know what you're talking about and that you know how to advocate for yourself. And I have just seen that when mamas know how to advocate for themselves, they get a very different experience from their healthcare provider, pregnancy or not. And I've just talked to so many people recently who have had that same experience, and they haven't even gotten into labor yet. I think it's important to have a healthcare provider that you can have those conversations with. Anyways, hope these tips were helpful. I had an amazing second birth. I had an amazing first pregnancy. My birth story and my birth plan did not go as planned, which is okay. But I think ultimately what I know now, and if I get pregnant again and have another baby, and even if I end up in a C-section situation in the future, God forbid, I want to know that I exhausted all of my options and that I was informed, and I made that informed decision to move forward with this intervention or this procedure because I was educated and I made that decision. Somebody didn't make that decision for me. So if you're pregnant right now, just educate yourself from as many professionals as you can. Get as much support as you can, because even if your birth plan doesn't go as planned, it doesn't mean that you're going to have a negative experience. You can have a positive experience in labor and in birth and still feel good about your story, even if it didn't go as planned. But it's less likely that you're going to feel that way if you feel like you were forced into a decision and you did not make that decision for yourself from an informed and educated standpoint. So I talk about this a lot in my course. It is a 4-week course, and we talk about everything from mindfulness and how to keep your mind in the right place so that you can progress through labor, to how to advocate for yourself, and then how to know your options, because there's some people who just won't lay out all the options, which is what my situation was when I was like, hey, is this my only option? And his response was, this is your best option. And I didn't know at that point, how to ask those other questions. So I talk a lot about this in my course so that people will go into their births confident, empowered, and ready to have the birth experience and birth story that they desire, or just be able to advocate for themselves no matter what that situation is. I know that if I didn't have a C-section the first time around and then have my birth story this second time around, that I wouldn't be doing what I do now. So I am grateful for that story, because I have seen both sides. I've seen what a hospital birth and been a part of a hospital birth that was natural turned C-section, and I've had a VBAC at a birth center in a very natural, loving, welcoming environment. And so I think that you can definitely have both. even in a hospital setting, but you have to know and be educated. So if you're interested in my next class, we're going to be meeting for 4 weeks on Saturday mornings. The link in my bio will give you more information on how to sign up for that. Share this, and if y'all have questions, let me know.